Okay, so I'm filming in my laundry room. I'm just going to show that there's nothing in here, and I'll pan around. There's nobody in here. Here's my dryer. So I'll film it on this because it's quiet up here. Okay, so I have an 8-month-old girl here. She's here for a pediatric well visit, so I'm going to do an exam on her. She would be stage 1 of Erickson's developmental stages. I would ask her parents about any allergies, medications, immunizations, and past medical health history. And I can either have the parents, if one of them wants to hold her on their lap, we can do the exam that way, or she can be on a bed with the parents close by. I'm going to do everything I can to make the experience as anxiety-free and stress-free as possible. I'm going to be speaking with her too and getting her used to me so she feels more comfortable with me, and save all the traumatic stuff I can for last, like licking her eyes, her mouth, and her ears. I'll go ahead and do a general survey, so we'll just say she's not wearing anything. Look at her skin, look for any rashes, lesions, bruising. Does she appear to be in any distress? Her respiratory effort. Look and see maybe if she seems lethargic, is she alert and awake, following me with her eyes, or looking around the room, or is she following like any objects I'm holding? Does she appear to be her stated age? And does she seem well cared for, nourished, clean? All of that. After I do that, I'm going to get her vitals. So I have the appropriate tools, appropriate size blood pressure cuff, pediatric stethoscope. I'm going to check her temp and her axillary. And then after I get her vitals, I'll go ahead and get her measurements. So I'll start at the top of the head, down to the heel of her foot for her length. I'll plot that on a growth chart to get her percentile. I'm going to go ahead and measure the circumference of her head around the eyebrows, circumference of her chest around the nipple line, circumference of her abdomen around her umbilical. And when I do her weight, pick her up, make sure her head doesn't lag, because she shouldn't be lagging. And if she's wearing a diaper, I'll put a blue chuck down and a diaper on the scale and zero it out. I'll place her in the scale and keep my hand over her to make sure nothing happens to her. After we get vitals and weight and her measurements, we'll go ahead and look at her fontanelle. So her posterior fontanelle should be closed. Her anterior fontanelle should be flat. We don't want it bulging or sunken. And then she should be able to sit up unsupported. We'll look at her spine and see if there's any abnormalities or any rashes, lesions, bruising, anything on her back. And we'll look at the 410s for any signs of abuse. So bruising where there should not be bruising at this age. She could have some scuff marks on her legs from crawling. We'll go ahead and look at her head shape, see if her hair looks evenly distributed. Look and see if her eyes and ears look midline. Everything looks symmetrical. Eyes, ears look symmetrical. Like I said, we'll see if she maybe makes eye contact or follows me when I'm talking. Look and see if we have any drainage in her nose. And like I said, I would check her last. Look in her mouth and see if she has any teeth protruding. Look at her mucous membranes in her tongue. And then, like I said, we look in ears last too, so I'd check and see if she has any drainage, debris, any lesions, see if anything looks red or inflamed. Clap, try to startle her, see if we can make sure she can hear us, or we can do whisper test, or if mom wants to call her name and see if she'll respond, have a response to that. Look at her neck. We'll go ahead and do a cardiology assessment. So I'm going to listen to aortic, pulmonary, tricuspid, and mitral, and I'm going to listen for a full minute. And we'll check her pulses. So carotid, oops, lost the badge. Carotid, brachial, radial, femoral, popliteal, and her pedal pulses. I'll check her cap refill, look at her extremities, make sure nothing looks cyanotic, everything's warm, pink. Look at her mouth and make sure there's no cyanosis there. Listen, make sure we had regular rhythm, and we felt regular rhythm when checking pulses. We can go ahead and do a respiratory assessment. So we'll look and see if we have any grunting or nasal flaring, any signs that she's having any respiratory problems or distress. She has a cough. We can look at her sputum if she's producing any. We'll go ahead and listen to her lungs. Side listen, anterior, and then her lateral, and then sit her up and listen to her posterior. We want to make sure everything sounds clear bilaterally. No striding wheezes, diminished lung sounds. We'll look at chest, make sure everything looks symmetrical there. They do breathe with their abdomen when they're younger. And we'll look and see, like I said, we check to make sure there's no cyanosis, so problems with her getting oxygen too, and then we'll go ahead and do an assessment of her abdomen. We'll look at her abdomen and the contour of her abdomen. We'll go ahead and listen to the 4 quadrants. And then light palpitation. Just want to make sure that she doesn't seem to have any tender spots or anything maybe causing her pain. We're going to ask and see how her appetite is, see how often she's feeding, what her stools look like, maybe what foods she's eating, how often they're introducing new foods, and just see how often like they're changing her diaper, or how often she's having bowel movements, when's the last time she had a bowel movement. And then I'll look at her genital area, see if there's any bruises, or cuts, hopefully not any bruises, lesions, any odor, drainage. Ask her parents if they've noticed any unusual odor from her urine, maybe what color her urine is. And we'll look at her anus, make sure there's no problems there, rashes or anything like that. I'll go ahead and look at her muscle tone and see maybe she'll grasp stuff. She should be getting the pincer grasp. Look at her legs, maybe she's kicking. We do range of motion in her extremities. I can speak with the parents and see if she's pulling up to stand on her own. She should be able to bear her weight on her legs while she's holding onto something like a couch. She might be trying to take like her first wobbly steps. And if she's not babbling or anything in here, I can ask her parents if she's been babbling at home. We can ask and see how she's been sleeping, her sleep pattern, if she's taking naps or if she's sleeping all throughout the night. And then I'm gonna go ahead and look at all of her skin. So we already looked at her extremities, so we looked at all of her skin on her extremities, noted anything abnormal. Look at her arm extremities, make sure we don't see anything abnormal there. Looked over her torso, looked over her head, her back, her butt, and made sure we didn't see anything unusual we need to document. Check skin turgor, make sure her skin turgor is good. And then I can speak with the parents and we can maybe give them some nutritional information, information about teething, her upcoming immunizations, and any upcoming appointments we have scheduled for her to come back for her well visits.